Hi, this is Jessica DeMassa in the HISA Studio here at HIC 2017. I'm here with Johanna. Johanna, please introduce yourself to everybody watching.
I'm Johanna Westbrook. I'm Director of the Centre for Health Systems and Safety Research at the Australian Institute of Health Innovation at Macquarie University.
Okay, that's a mouthful. I'm glad I had you say it. So tell me a little bit about what you're working on right now. What's new and exciting?
Okay, well, we're really interested in what's called cognitive informatics, and it's a relatively new sort of discipline area, and it's really looking at clinical work and cognitive capacity of people. And how we can design better clinical information systems that take account of these things.
Okay, so what does cognitive capacity of people really mean?
Well, it really takes into account the fact that when people are overloaded with the number of tasks that they're undertaking, when they're interrupted frequently, when they're trying to do two things at the same time, that creates a very heavy cognitive load which may impact on their performance.
Okay, so this would be useful obviously in healthcare for reducing medical errors and for delivering better quality care, things like that.
That's right, and we're interested in how do you design clinical information systems when you acknowledge that clinicians are under different cognitive load at different times.
Okay.
So we've sort of really studied junior doctors' work, for example, and followed them at night time and on the weekends and during the day, and we find they've got very different patterns of work which put different demands on them, and we need to be designing clinical information systems that actually fit their work at different times.
So this is like the ultimate UX design for a clinician.
Well, you could describe it that way. Yes, and it's recognising that probably information systems need to be adaptive, that they can't be static because clinical work isn't static.
So how are you designing for this then? How are you approaching changing these workflows so that they are more conducive to the actual reality of what's going on when a clinician is practicing?
Okay, well that's not actually our role. So we're researchers and we go in and actually try to describe how clinical work is actually performed in real world situations, rather than often we see clinical work is very linear, and that people just give them policies and procedures and they'll follow through. But actually, when we go in and observe clinical work, it's very interruptive. People are trying to do multiple things at the same time, and so it's quite different. So our role is studying that.
Okay, so with the research that you then provide, how can others use that research to help solve that problem?
Well, we've been particularly looking at emergency physicians, for example, and we've found that they have very high rates of interruption, and they're also trying to multitask a lot of the time. And so we have to think about, well, if we had a clinical information system that would support those people, it might be doing things like being able to help them recover from interruptions better, maybe providing information so people don't need to interrupt quite as frequently, those types of functionality aspects.
Okay, fantastic. So how often is a clinician interrupted?
Well, we found with emergency physicians that they're interrupted about 8 times an hour, but it goes up to 9 times an hour when they're trying to do prescribing. And we found that the more they're interrupted while they're prescribing, the more errors they make.
That's very insightful, and it really does put some parameters around that particular problem so that someone can go out and solve it. What else are you noticing in your research? Are there any other big takeaways that you think our population of digital health and health IT viewers would be interested in learning?
Well, we're very interested in studying communication patterns and how people can communicate better and how information systems can support that better communication to reduce errors. So that's another area that we're studying.
Okay, and what is it about communication in particular? Is it a lack thereof or over-communicating?
Well, what we found is that when we compared different hospital wards, and we found those wards where the doctors and nurses spoke more to each other about medication issues, they had lower prescribing error rates than those wards that had less communication. And also when you look at the culture of those wards, so those wards where doctors and nurses, when you asked them, thought it was important to communicate, they also had lower error rates. So I think it all goes together to demonstrate that communication is really inherent to producing a safer healthcare system, and digital health is a way of trying to support better communication.
Fantastic. What's next in terms of like your research or what you're looking forward to looking into, I suppose, over the next couple of years as you're studying this from a systematic point of view here?
Well, we've got a number of different projects underway. So we're looking at children's hospitals and the introduction of electronic medication management systems and whether they reduce errors. We're looking at aged and community care, which has been a really neglected area, and these people are moving across the different sectors of the healthcare system, and information technology could really potentially benefit that group, and we need to do more research in that area.
Fantastic. Thank you so much for joining us and for sharing your perspective. It was wonderful to hear from you. I'm Jessica DeMassa in the HISA Studio here at HIC 2017. Thanks.